Okay, hello everybody. Good afternoon. Assalamu alaikum. Shall we start then, Dr. Athar?
Yes, ma'am. I'll begin with the thing.
Yeah.
Assalamu alaikum, everybody. ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. ربي يسر ولا تؤسر وتمم بالخير وبك نستعين يا فتاح ربي زدني علما ربي زدني علما. Good afternoon, everyone. Muhammad Athar Saifuddin here, a student of MNR Medical College 2020 batch. I'll be your anchor for today's session. Hope you all are doing well. It's a great pleasure to welcome you all to this session, where we will learn on how to navigate your medical internship with a purpose, which is organized by IMSA, the Initiative of Medicos for Service and Academics. What is IMSA? IMSA is a non-profit initiative taken by Medicos from all over Telangana, aimed to create a unified platform for medical students working towards self-improvement and upliftment of society under the divine guidance of Islam. We are extremely grateful to the members of IMSA for organizing this webinar to further our knowledge on this subject. I'd like to thank Dr. Amreen ma'am for taking out time from her schedule to enlighten us with her experience and advices on medical internship. Moving on further, ma'am is a dedicated, compassionate pediatrician with a stellar academic record, including 7 gold medals in MBBS and a state university gold medal. She is passionate about child healthcare and parental education with strong commitment to improve pediatric care from infancy to adolescence. Currently, she is serving as a consultant pediatrician at Caspian Healthcare. Ma'am has completed her MBBS from Gandhi Medical College, Secunderabad 2K11 batch. She has completed her MD Pediatrics from Niloufer Hospital, that is Osmania Medical College, Hyderabad 2K19 batch. Ma'am has been awarded as the best outgoing student from Gandhi Medical College. Speaking about the field of skills and expertise are as follow: general and preventive pediatrics, neonate and infant care, growth and developmental monitoring, pediatric nutrition and immunization, parental counseling and education, child psychology and behavior management. So now I'll hand over the stage to Dr. Amreen ma'am. Ma'am, you can take it further.
Yeah. Assalamu alaikum, everybody. Thank you for sparing your afternoon for this session. I think all of you might be either entering internship or might be currently doing internship. So I think I'm addressing people who are either interns or going to be interns. So let us start with our session straight away. Okay. Can we start the slideshow first on the screen?
Ma'am, is my screen visible?
No, I'm not. You are viewing, yes, but on the screen, I'm not able to see the slideshow. Yeah. Can you make it full screen? So in the session, I would like to answer every query that an intern or a going to be intern would have in their mind. And let us first have this session, and at the end, we can have a Q&A where I'll be answering your queries. So this is me. Next. So first, let us find out, is internship even necessary? What is the purpose of internship? Currently, a lot of people who are either preparing for USMLE or who want to very quickly get into a postgraduate program, they think that internship is not even necessary. So it is something that we can very easily skip. We can go to the next step. Anyway, we'll learn everything in PG. Why do we need to go through this hassle of going from department to department for 12 months and all these issues? Why do we need to even face this? So I know a lot of people who are considering to skip internship. So do you really need to do internship or not? So this is my take on this. See, first, I feel before you even become a specialist or a super specialist, it is important to be a good MBBS doctor. Your ultimate goal as a specialist or a super specialist is to build a good practice that involves for you to be able to do the best for your patient. And if you are to do the best for your patient, you need to lay your foundations very strongly first. So if you are a good MBBS doctor who has a good overall knowledge, you know something about everything in every department, then you will be able to help the patient. For example, I see a patient, a 3-year-old child who maybe has some ASOM or CSOM. That is not my department of expertise. But because I have been to ENT department where I have done my internship 15 days, okay, but I know that this is how it presents. These are the symptoms. I need to know, well, I will be able to know what the initial treatment is, and then I will refer to ENT. Instead of saying, "Bhai, aap ENT ko chale jao," I will first give them some reasonable treatment and then shift. Similarly, whatever be the department, different departments may, suppose you are in casualty. There you will learn a lot of emergency procedures. You will learn how to deal with emergency patients. You will deal how to break bad news. So all these skills are very much necessary to first become a basic MBBS doctor. So internship in short will teach you a little bit about everything so that when needed, you are able to bring those skills forward and utilize them and leverage them to your advantage. And the second thing is internship का सबसे बड़ा advantage is that it is a responsibility free area for you and you are allowed to make errors. मतलब once you complete your internship and you are an MBBS doctor, you are now expected to have a level of expertise and a level of knowledge that errors will not be tolerated after that to a degree. Okay, you can learn even as a resident, but then your level of responsibility on you will be more. But in an internship level, your responsibility is very less. Not much is expected from you. You are okay with making errors. And that doesn't mean that you should go ahead and make errors, but I'm telling you get that ability to learn aram se. And because it is okay to make errors, you will be able to, go all in and try to do the best for your patient. And this is the most important one actually. Once we finish our MBBS, then we finish our specialization or super specialization. And when we come into practice, you know what is the most important thing that will build your practice? That is your communication skill with the patient. Because whatever knowledge you have, it is fine. But if you're not able to communicate this knowledge, communicate the skill in front of the patient, what is the point of all that knowledge? So in internship, while observing your professors, while observing your residents, while observing the people around you, while interacting with the patient, every encounter, every chance at communication is a learning experience, something that you will use for the rest of your life. So it is very important. And it is during internship that you learn breaking bad news also. For example, you have your own setup later. In case something goes wrong, you know how to deal with it. You know at what stage you need to keep intervening. You will know when you need to take consent, how you need to talk to a patient, what kind of a body language you need to have to talk to a patient. If you are just sitting and reading and reading and reading, you are clearing NEET PG, going for residency, clearing NEET SS, going for super specialty, and then you come out at 35 or 30s and you are suddenly now a super specialist, but you know the knowledge required to be the doctor, but in the real life scenario, you will not be able to practice well. So internship teaches you a lot of important things. So ultimately, the takeaway message is you need to attend your internship. See, internship, the level of experience that it will give depends on the hospital that you are doing internship as well. I'm not going to uh, lie about that. If you are doing it in a good government setup, that will definitely equip you a lot more than private setups. But if you are still doing it in a private setup which has a good patient flow, it is still better. But if you are doing it in a private setup where there is hardly any patient flow, still take advantage of whatever you have, and whatever the rest of the time you have, you try to prepare for your post graduation because it's better than wasting time. Okay, next slide. Yeah. So your role in internship. So what are the internship expectations from you? See, the first and the most important expectation that you need to have is that not all departments will be the same. See, you are doing internship in medicine, that will be very different from your internship in surgery, from gynec, from ENT, opthal. So every department brings certain things to you. There'll be certain things to learn in each area, and you need to be eager to learn. And what is expected of you is that A, you show up, B, you show up with dedication, not just wake up and go and just do something, write something and come back. If you show up with dedication, then there will be people who will be eager to teach you. So, but you have to show up first. Okay. And here you learn more by doing rather than by, reading or listening or seeing. It is, you can see 100 videos on how to put an IV cannula, on how to put a Foley's, on how to do a venesection, on how to do suturing. But unless you do it on a real-time patient, you don't get that learning, you don't get that confidence to actually practice it in real life. So your role in internship is to, as far as possible, to the best of your ability, show up and show up with a lot of interest each and every day, so that people, when they see that interest in you, they are drawn to, pick you up whenever they require, for example, if you are doing internship in the general surgery department, there will be one intern out of the lot, maybe 8 to 10 people who will get to do that hydrocele surgery or get to do some procedure. You know, who is this person? This person is the one who has shown up right from the day one, who has shown interest, who has assisted the residents in doing all the scut work. They have stayed in SOT, helped the resident in doing all the uh, dressings and all that. So they have done all the rote work, and that is when they get noticed, and that is when they get picked up. So you need to do that hard work before you get chosen to do the more shiny and more lucrative kind of work in this. Um, so yeah, you need to help others to gain opportunities. You need to help your resident. You need to help your assistant professor. You need to help your professors. It might seem like you are at the bottom of the pile, but yes, you are. You need to accept that. And there is no ego in the medical field. You have to sometimes also feed other people's egos. I'm not saying that that is the right thing to do. I have never truly, in my experience, ever harassed my juniors, and I know a lot of good seniors who have not harassed their juniors, but it does happen that a lot of people do have this expectation that if you are a junior, if you are an intern, you are a bit more nicer, you are a bit more, accommodating and helpful in other aspects as well. If you do that, if you build a good relationship with your residents, with your professors, you definitely will have more opportunities to learn an internship. So I would, urge you to do that as well in your internship. So next slide. See, types of work and attitude, essential skills and opportunities. See, if you want to learn any sort of skill in your internship, you can do it in two ways. You can float through it. You can go to the low performing departments, low performing areas. You can just pass your time and get through internship and not really learn much. Or you can really show up, show that interest, go to the areas where you can learn more. Maybe it takes a bit more extra effort from you, you get lesser breaks, you get more exhausted, but you will learn more. For example, you are in the labor room, now it's a 30-hour duty for you. You can either stay in the main labor room area where the deliveries are happening, where the episiotomies are happening, where they can call you for assistance into C-section, or you can simply sit in the step down and monitor BPs, because you get a 1 hour break every hour. You can just sit, एक घंटे में एक बार एक 5 BP देख लिया, and you sit आराम से. You can choose either of these. But if you keep choosing the step down area over and over again, irrespective of whether you are exhausted or not, then you don't really learn how to manage labor, how to manage episiotomy. See, you might never come back to this department all your life, whether that be labor room, whether that be your casualty, whether that be ENT, opthal, whatever. You will not come back to this department all your life as a working person in that department. So try to find areas in the department where the learning really happens and go there and be present over there and be eager, to grab the opportunity when it comes. Ma'am, I'll do it. Ma'am, can I do it? Or sir, can I do it? Or you just have that attitude that I want to learn. And whenever your resident is going for some sort of procedure, try to accompany the resident. Try to, always no, be in that zone where you're eager to grab any opportunity that comes on your path. For example, I'll tell you personally what I did. I was posted in general surgery in the beginning of my internship. It was my resident asked me whether you want to stay in this area where you can do the vital check, or you want to come with me to the surgical OT, minor surgical OT, where you will have to do dressings. I didn't think much. I told I want to come to the surgical OT because I want to learn. So I went down with her. There were a lot of dressings. Maybe we did that for 3-4 hours that evening till 11 o'clock, 12 o'clock at night. It was horrible. It was smelly. It was bad. But because I stayed with her that day, she took me to every call that she got. She took me to the burns calls. She taught me how to do venisections. She took me to the emergency OT where we did an amputation. And she taught me suturing. And I learned much before my counterparts because I showed that genuine interest, because I was, okay with doing all the baseline, not so appealing work. I got to do the really skillful job as well. So you need to have that attitude in internship. Next. Next slide. See, facing criticism in learning. You are going to face criticism in internship. You have to be okay with that because you are new now. You might have learned a little bit in your MBBS. You have little bit of knowledge, okay? You have the requisite knowledge, but skills very less. So you are obviously going to make mistakes. It will happen. And while you make mistakes, you might also face criticism. Your resident will say, "Inta kuda rada, ye bhi nahi aata kya?" This is going to come. But your job at that point of time is not to get dejected. Your job is like, I'm going to try over and over again. I'm going to watch videos. I'm going to read about this. I'm going to come back and I'm going to keep doing this again and again because I don't get this opportunity where I'm responsibility free and I can do this over and over again on a patient. Especially if you're in a government setup, you have to take full advantage of this phase. You don't worry about the criticism. Take it through 1 year and leave it off through the other year. Forget about it. Whatever feedback is there, you take it in. You look at the positive side of it, the negative side of it, whatever you feel like is analyze it and try to work on it over and over again. See, medicine is a lifelong learning journey. You have to be a student always, and you have to be okay with criticism always. You cannot be like, हाँ मैं doctor बन गई, मैं almost doctor बनने वाली हूँ. How can she say this? How can she do this? If you have this level of ego, it will hinder your learning process. So it will be, एक तरीके से it will be negative for you in the long run. So don't have that attitude. Have a okay, it's okay, chalta wala attitude, and keep learning and keep showing up, and you will be much better than your initial days. Next slide. So that was about internship. So always remember, keep showing up with dedication. Try to keep going to areas where you get to learn more, get to see more of procedures, get into more of procedures, and don't feel bad about anything that your resident says, anything that your professor says. If it is going into abuse, yes, obviously report that. But if it is daily kind of a thing where they are, some little bit of politics, little bit of backbiting, whatever, it's okay. Let it slide, let it go. It's not that important right now. A more important thing is for you to learn. So let us now come to time management and NEET PG preparation. So when should you prepare for NEET PG? Right now, I feel the ideal time to start preparing for NEET PG. I hope if they are interns, they don't get dejected by hearing this. But the right way to start preparing for NEET PG, I feel right now, because you have these apps like Marrow, Prep Ladder, वगैरह, is right during your MBBS days when you are reading. your textbooks. You can use your Marrow to do the question and answers, and you can watch videos also if you have the time and make some notes. But in case you haven't done that, it is fine. I didn't start my NEET PG preparation till after my internship. I couldn't do it during my internship because my internship was very hectic when I was in Gandhi. So I did it after my internship. So ideally, if you are able to start it during your MBBS days, if you haven't done that, you are right now starting internship or are in internship. If you are in a government college, it might be really difficult to do justice to doing a proper internship and also prepare for NEET PG. It will be very difficult. If you have that capability, go ahead. If you are not having that capability, don't feel bad. Do internship properly. You won't get this aspect of your life back again. If you have to choose between preparing for NEET PG, leaving your internship, and doing internship and preparing for NEET PG later, choose to do internship now and prepare for NEET PG later. If you are in a private setup where there's not much work in your internship, you get that free time to study, utilize that time to study. When you're preparing for NEET PG, the most important thing, number one, most important thing is to have good notes. So if you are going for online or offline classes, prepare notes in a very good manner. And when you are preparing notes, give ample space for adding any points later. For example, if I am attending a medicine class today and I am reading about CVS and I am writing my notes, I have to give enough space in my notes so that in case I read about CVS medicine from another source, like today I'm hearing from one speaker and tomorrow, if I feel like, if I have the time for it, I listen from another speaker so that I can add additional points, add it to the same notes that you first prepared. What this does is when you are finally going to give the exam, you have one source of notes. It should not be like, should I read from this book? Should I read from that book? Should I read from these notes? Should I read from those notes? No, you should not have this confusion at all when you are going for your final exam. You need to have one consolidated source of notes. That is the most important thing. Second most important thing is when you are attending, especially offline classes, you will have 3 to 4 days of classes, 3 to 4 days of rest. This is usually how it happens. So you attend the classes. When you are attending the classes, sit right in the front, right where there are no distractions, make notes properly, have a proper sleep, eat properly, focus completely when they are teaching, try to learn as much as possible right during the class so that your effort in learning later becomes very less. Don't be sleepy in the class, I'll refer the notes later. Don't have that attitude. Be active in making notes. And then when you get the 3-4 days of a break, read these notes again. And if you have any test series with you, Marrow or Prep Ladder or whatever online test series or offline test series you have, whatever notes you have read from, you try to solve the MCQs of that same topic. This is how it should keep happening till your subjects are complete. And ideally, your subjects should be complete at least 3 months before your exam preparation is, your exam date is coming. So that is very important. And keep doing test and discussions in between. A lot of coaching centers offer these test and discussion series. So what they do is they will give you a question paper, you answer it, and then you sit back and you see whether you did it right or wrong. And when you are doing this, if you have done something wrong, then you are able to correct the answer first thing, and then you are able to understand what you have done wrong, why you have gone wrong in this place, what is the right approach at this place. You are able to understand that. And one single MCQ will teach you a lot of topics associated with that topic. So it is not just that one MCQ that you're solving a lot of high-yield areas of the important topics. And I would personally advise you against going with self-preparation. See, NEET PG, you have 19 subjects, you have a lot of topics, and you really, on your own, if you are preparing, you don't know what topic is important, what topic is not important for this exam. And this exam is a competitive exam. It is not an question and answer based exam where you can write lambe answers and when you can showcase your knowledge. You need to do the MCQs right. You need to get that rank. You need to do better than others. That is the most important thing. So these coaching centers have cracked the code. Why do you want to take it on yourself to, go through the process again and try to do it on your own again? It might take you year, 2 years, 3 years longer than that. Why waste your time at this point of time? So go to the tried and tested sources and prepare this way. Okay. and start grand tests at least 3 months before your main exam. I would say 6 months before. Start with one grand test per week. Okay, schedule a time, and ideally I would say अगर आपका NEET PG is from 9 a.m. to 12:30 p.m. for example, your grand test should also be at the same time so that it simulates for you that exam giving experience. What a grand test teaches is one, time management. How do you within those 3.5 hours manage to do those 200, 300 questions, how many ever you have right now, I don't know. So you should be able to know that. And how much time does it take for you to all those questions, come back, revise, do the necessary questions, whether to answer or not to answer, if to answer or not to answer, if you know three options, if you know two options, if you know one option only, you get that, trial and error time when you give a grand test. So start with once a week, 1 month or 2 months before the exam, try to do a grand test every alternate day or every day, right at the same time when you have to give the final exam. And this really teaches you time management, and this really teaches you what the high areas are and where you should be focusing more on, and keep revising your notes, same notes. 3 months before your exam is starting, no new preparation should start, no new videos, no new material at this point of time. Whatever notes you have consolidated with you, keep revising this over and over and over again. That is going to give you a lot of advantage in the end. When you try to go for new sources 2 3 months before the exam, what happens is you might learn a new point, or maybe that will contribute to 1 or 2 marks, but because of that you are not revising the already known portion, and that decreases a lot of your marks because of not keeping that in your fresh memory. So grant tests are very important. And at this point of time, I would like to also say, um, see, NEET PG preparation and internship or post internship, it might not be ideal for everybody. Some of us have financial constraints at this point of time. Some of us have families who require our financial assistance at this point of time, who expect us to earn and provide for our family. So it is a very real situation for a lot of us. And at this point of time, I would say you can take this 1 year and you can earn and you can read also. You have to make a choice. For example, I will tell you, your family expenses are say 30,000 or 40,000 per month, bare minimum expectation, a bare minimum income expectation that will just let you go by. But this 30,000, 40,000 job is very chill and you can study. And there is another job which is fetching you maybe 80,000 to 1 lakh, but that doesn't give you any time to study. If you have this option in your life, I would say choose the 30, 40,000 option. Let your family have that bare minimum living expense for 1 year. It is fine. But if you can spend that time in studying and cracking that NEET PG exam and getting that PG seat, then your career growth will get very much accelerated. And over the next 3 4 years, you will be able to provide much more for your family. So this 1 year of sacrifice is fine when you look at the long-term goal. So this is my advice to people who need to earn, who need to take care of their own family also while preparing for NEET PG. So next, let's go for the next slide. Yeah, grant test and revision I have already covered. Next slide. See, yeah, at the end of internship. Now you have completed your internship. What are certain things that you should know at the end of your internship? Number one, what departments you absolutely hate, you do not want to get into. You need to be very clear about this because you have gone to all the departments over this 1 year. See, reading a subject and working in that subject is completely different. I might like to read psychiatry, but I will not like working in psychiatry department. Similarly, it might be different for you. So you need to first know what you don't like. Two, what are the top 1 2 3 things that you like, branches that you would like to choose in your NEET PG. You need to know this because you have been to all these departments. You will know what kind of a working environment is there in each department, what kind of a subject knowledge skill is required, where do you really see yourself, fitting in. You need to know this at the end of the internship. And then you need to have gained a little bit of practical experience, with proper communication, proper knowledge, proper skill of a basic MBBS doctor. And at this point of time, you should know, am I going to prepare for USMLE? If you have not already decided, ideally you should decide for USMLE in your final year MBBS. That would be a good time, or third year or final year MBBS is a good time. Or at least at this point of time, you should know, is it USMLE? Is it lab? Is it NEET PG? Is it some government job as an MBBS doctor? Is it some fellowship, or is it some emergency medicine course? Whatever it is, decide. Don't be floating around at this point of time. हाँ ठीक है, देखेंगे, सोचेंगे. If you do this at this point of time, then you will waste a lot more time, because you will be left behind at this point of time if you have not decided. And you need to also, if possible, have a long-term goal for yourself. What is it that you like for yourself? Is it private practice? Is it government setup? Is it corporate? Uh, just have a rough idea. Where do you see yourself 1 year from now, 3 years from now, 5 years from now, 10 years from now? You need to have that vision board in your mind. It might change over time, but it is good to have one. Next. See, this balancing faith and medicine, I think, is very important. First thing that I will say is have a good intention. It is said that if you go with the intention of visiting the sick and offering them kindness, then you are rewarded for every step that you take towards that hospital as well. So renew your intention every day. Think ki I'm going to do goodness to somebody. I'm going to do kindness to somebody. And Allah Ta'ala will reward you for this. God Almighty will reward you for this intention of yours. When you have that intention, automatically your approach changes, your body language changes, your communication changes, your level of empathy for your patient also changes. When you see a patient who is constantly asking you the same question, you don't get irritated. In fact, you worry, oh my God, he's going through such a bad situation. That is why he's constantly asking me this question. Let me try and help him out. You have this approach rather than, what is this? They keep asking the same question. They keep repeating the same statement. You will have less of this attitude and more of a gratitude and more of an empathetic kind of an attitude. So renew your intention every day. Second thing, try to fulfill your religious obligations. Not try, fulfill your religious obligations. There is no second option about it. It will be difficult to offer the non-obligatory prayers, but obligatory prayers should not be an option. You have to offer them, irrespective of whatever department you are in, irrespective of whatever duty you have. You can take 5 minutes out, go, offer your obligation and come back. And try to do a spiritual connecting every day. 5 minutes of zikr, 5 minutes of Quran. It's going to refresh you for the whole day. For example, if I have recited Surah Nashra, Alam Nashra Laka Sadra. When I come to the verse Inna Ma'al Usri Yusra, and I know that it means that with difficulty there is ease. And I am able to read this one verse in that one day. And I am able to circulate in my mind that verse throughout my day. Whenever I'm faced with difficulty, I remind myself, with this there will come ease. With this there will come ease. And how much of an ease that creates for me on my mind and on my heart, on my physical health is immense. So try to keep doing that. You might not be able to do as much as other people outside of medicine might be doing, but in you, with your job, whatever you are able to do, that is what you will be judged for, that is what you will be rewarded for. So try to do as much as you can and try to maintain a balance always. Next. Mental well-being. See, mental well-being is very important during internship. Internship is a burnout period for a lot of us, because up to that point of time, we have never worked that hard. We have never been that sleep deprived. We have never, seen so much of blood, so much of tears, so much of sweat, so much of negativity, so much of bad news ever in our life. And to see that, witness that every day without sleep, without proper food is exhausting. It leads to burnout. I'm not going to lie about that. So again, for mental well-being, the first thing is spiritual well-being, in my opinion, because if you are connected to your Lord, then He makes it easy for you. I was a child who, when I was 6 years, 7 years, I would cry at the sight of blood. I would not want mud to touch my feet. But Allah Ta'ala gave me that strength. Allah Ta'ala gave me that faith to, even witness deaths, even witness active bleedings, even witness, mangled bodies and amputations. Something that I didn't think I would have the strength for, He gave me the strength for it. I didn't have that strength for it. So your spiritual well-being is the route to your mental well-being. Second thing, if you ever feel burnt out, which you will during your internship, you need to be resilient. You need to, try to get that strength to push yourself. But if it is going beyond a certain point, if you feel like abhi pani sir ke upar ja raha hai, then take a casual leave, go back to your home, spend some time with your parents, spend some time with your siblings, spend some time with your friends, people who really get you, who really understand you, and take that break and come back refreshed. Okay, so don't be too hard on yourself, but keep pushing yourself also. There's a good balance that you need to strike over there, and you need to keep striking that over and over again, especially in medicine. That's an everyday job for us. Next, I think we are at the end of it. Yeah. So I hope you have found something at least useful from the session. If there are any question and answers, I would like to take them.
We are done with the slides, ma'am. So, mashallah, your explanation was just, out of this world. You have, just opened so many, thoughts in our mind. Basically, we are waiting for our results, and we are, just uncertain about what we are going to face in our internship. So, it's a big thanks to you, ma'am. So, guys, I have just posted ma'am's Instagram handle in the chat box. If not, if you have joined a bit late, I'll post it again. And I have also posted ma'am's WhatsApp channel link. I suggest you all to join that. Ma'am posts, very informative videos on her Instagram handles. Next thing is we'll move on to question and answers session. If any one of you have any kind of doubts, they can just post in the chat box, or you can open your mics and you can just throw your doubts.
Yeah. So the first question, I think, is for girls. It's a marriage problem. Can you please discuss it? Yeah, I would think. Yes, that is the most often asked question. When to get married, when to have kids, with all these things going on as a doctor, as a girl especially, it is a bit more difficult than it is for boys. Yes, their difficulties are a bit different, especially if they have some financial responsibilities. But for a girl, the question of marriage and the question of kids happens. So for me personally, I'll tell you what my experience was in this regard. So I got married in the first year of my post graduation, and my father actually and my mother, they had started asking me about getting married right from my final year and my internship, but I was pushing them. I told them, see, the minute I have a PG seat in my hand, you can get me married. It is fine. I don't care if it is right on the day when I get my results that I have got my PG seat, because I had this idea that NEET PG preparation requires a lot of, mental alertness and time and effort. And once you get married, you really don't know the kind of family that you're getting married to, the kind of spouse that you're getting married to, whether they'll be supportive of this or not, and the level of that support that they will offer. But I know my parents, I know the support that I have at my home. So this familiarity is it is comforting for me. So I felt that at that point of time, that it is better if I, crack this very important exam that I have, felt that I need to crack for myself. I had this thought for myself that I need to get into post graduation and then get married. And when it comes to kids, I was of the thought process that if I am compatible with my spouse and I feel like it's a good marriage, then I am not going to delay kids, because kids are a blessing. It's an amana from Allah Ta'ala. And managing post graduation and kids is very difficult. I had my daughter in my second year of my MD pediatrics in Niloufer, and taking care of her and taking care of my MD, where I had almost sometimes 6, sometimes 8, sometimes 10 duties per month, was difficult. I had the support of my mother and my mother-in-law at that point of time, because they used to take care of my daughter in my absence, but I also was nursing her, so I would have to keep coming over and over again. I took a 6-month maternity leave, which extended my post-graduation period by 6 months, but I somehow managed it. And I got pregnant with my second baby when I was in my third year, right before my exams. And I gave exams when I was almost 9 months pregnant, and I delivered him 2 weeks after my exams. And I had my third a year later. So Alhamdulillah, I have 3 kids now, and I have 3 kids now, and yeah, I take the job of a mother, of a pediatrician, of running this clinic along with my husband, and content creation now, and I'm able to do it smoothly with the support of a few people who I employ in my family. So yeah. Is there anything in particular that you would like to ask me about, like marriage and all? You can
Ma'am,
post it
there is one more doubt. The second doubt,
now.
ma'am, in private medical college, we don't get much opportunities to learn necessary skills. What is your advice on that?
Sorry, I pressed something and I got logged out. Are you able to see me now? Hello?
Yeah, ma'am, you are
Yeah,
loud and
yeah,
clear.
sorry. In private medical colleges, you don't get much opportunities to learn and see during internship, you're saying?
Yes, ma'am. We don't
Yeah.
get much opportunity to learn skills. What is your advice on that?
See, I have this attitude that you need to work with what you have. Okay. If you constantly think about, I do not have this, I do not have that, if I had that, I would have done that. If you have that attitude, you're not going to get anywhere. So, whatever learning opportunities you are getting within your medical college, utilize those. If you are getting time, that is also a big resource. Prepare for NEET PG. Even in your post graduation, when you are, if you are able to get a good post graduation seat in a government college because of this preparation, that's a win win, right? A lot of my colleagues and a lot of my juniors in Niloufer were from private colleges. They didn't have much exposure in their internship. But in that first year, in that first 1 to 2 months, they were able to cover up for whatever they lost during their internship, and they were able to develop that requisite knowledge, requisite skill during that 1 to 2 months also. It, provided they had that interest, provided they gave that extra time and effort at that point of time. So my advice is, don't ever think about what you don't have. Whatever you have, you work with that. If you are able to do a transfer internship in a government college, it is fine, but I think that is not working right now. So whatever college you are in, whatever learning opportunities you have, show up, try to learn whatever you are able to get over there. And if you are not able to learn certain things, utilize that time to, prepare for NEET PG, go through videos that will teach you certain skills, practice in other ways. Like if you want to learn suturing, you can, join some basic courses on suturing. You can start using certain materials and learn suturing. And for example, such things you can do if you want to do it. Yeah. Next.
Ma'am, how to balance prep for USMLE along with internship?
I might not be the right person to answer that, but I will tell you what I have seen with observation rather than experience. Sorry for the disturbance. Yeah, the right way I think to do this is, ideally, if you want to do USMLE, you should decide that during your second year or third year, that you want to do USMLE. If you want to do USMLE, you should, if you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. If you are able to do it, you should do it. can complete your preparation of your step 1 before your internship starts, and after internship you take a month or so and then you give your step 1, so that you don't miss out on the benefits of internship. If you are somebody who wants to give the step 1 during your internship, yes, you will have to take a break. You will have to maybe take 3 months off, 4 months, 5 months, 6 months. I don't know how long it takes to prepare for step 1. It's again individual based on your level of knowledge and skill, that you need to take the time off and then prepare. But if you want to get the benefit of both, decide early, prepare for step 1 early, give it right before internship or after internship by taking a few months off before. Like complete your internship, take 1 to 2 months and then give your step 1. Because you're prepared already before you have your resources in hand, you will be able to, with that quick brush off also, maybe clear step 1. But I'm not the right person to say it again.
If anybody wants to ask their doubts by opening the mic, they are free to ask their doubts, please. Aisha.
Yeah, Aisha, you can go ahead.
No, nobody?
Are there any more messages in the chat box?
Yeah, ma'am. Someone is asking what is the difference between DNB and MD?
Difference is that in DNB, you do it in a private setup. In क्या बोलते हैं, more of these corporate hospital kind of setups. In MD, you can do it either in a private medical college or a government medical college. The advantage of MD, I will say, the advantage of MD is that you will be most likely attached to a teaching medical college or a teaching hospital, and the resources are much more. Your professors are more, your assistants are more, your seniors are more in number, and you're obviously, when you are learning in your post graduation, happens mostly from your seniors. You see and you learn. So when you do your MD, especially in a good government medical college, at least in a private medical college where you have a good patient load and a good set hierarchy, then your learnings will be greater. Whereas in DNB, sometimes DNB approvals are given even to hospitals that are not that equipped. So your opportunities to learn might go down. And the other thing is in DNB, what I have heard is, though the timings are more compared to your MD, like in my MD, our timings were 9 to 4, and then if we had a duty, we had to stay by. But in DNB, they have to stay from 8 a.m. to 6 p.m. irrespective of whether they have a class or not, whether they have a duty or not. So timings are more, but the learning might be a bit less. And your professors, your consultants might take even non-subject related works from you, taking advantage of the fact that you are ultimately at their disposal and at their mercy for passing the exam. And passing the exam seems to be a bit more difficult in DNB. There seems to be a bit more toxicity with the consultants. So these are a few factors because of which I would say DNB a bit careful when choosing it. But if you are getting DNB from a good institute, an institute that has a already established legacy, and you are getting it suppose in a clinical branch, you are not getting MD in a clinical branch, you wanted a clinical branch very badly, but you are getting DNB in a clinical branch, go with it. Don't try to again take 1 more year off to prepare. So DNB is an option when you really want a good clinical branch. You're not able to crack that clinical branch in MD. You don't want to waste another year. Go ahead with it. Once you are in the branch, learning can happen throughout your life. For example, I am not able to get MD pediatrics anywhere, but I have cracked DNB pediatrics and I got it in a good place, for example. And now I get into pediatrics. I somehow finish my DNB. Then I can learn even after that, right? It's fine. You can learn even after that. You can go gain experience as an SR in a government medical college and you can learn. But you have gotten into that branch, right? So it is not one size fits all. If you are getting an MD, MS seat in a government college, best. Then if you are getting an MD, MS in a private medical college, which has a good exposure to patient, and MS from a less known college, not much exposure, then I think somewhere DNB from a recently approved institute. So go in this order. Whatever fits you, whatever suits you, everyone's situation is different, everyone's capabilities are different. You can choose according to your ability. Yeah.
Ma'am, there is one more doubt from Jabin. She's asking, ma'am, even at this stage, I'm scared about blood and get fainted whenever she sees situation like NVDs. How to overcome this problem, ma'am? Hematophobia, basically.
So you can any phobia, like I'm not talking as a doctor, but somewhere we have learned it in psychiatry. You either can gradually get exposed to it, or you can flood yourself with it. For example, there is this thing that if somebody is afraid of a scary movie, or somebody is scared of a snake. So, how to remove the phobia of snakes? First, they will see a video of a snake. Then they will see a real rubber snake somewhere kept near to them. Then they will see a snake in a zoo, real snake in a zoo, which is in a cage. And then they will see a real snake which is kept somewhere near them. And then they'll put a snake on their back, a non-venomous one. But this will remove their fear. Or somebody can directly put them in a room full of snakes which are non-venomous, which will not harm them for a period of maybe half an hour, and their fear will be gone. So whatever suits you, you can directly either go to your labor room, sit over there. You will see a lot of blood. It might make you puke for a while, and you might faint there also. But you will know that that will not be the end of your life, and you will still carry on with your life even after that experience, and you can get over that fear. Or you can gradually, prick somebody for GRBS, see a drop of blood, then take somebody's IV, see 5 ml of blood, then see it, take care of somebody's blood transfusion, see 100 ml of blood, then attend a delivery, then attend a surgery, then attend an amputation, and you can gradually, go up that zone and reduce your fear of blood. Because ultimately you have to, and then in case even if you, after going through all these phases, you still have this irresistible, fear of blood and it is not going away, then choose radiology in your MD and you will be, out of that zone forever. Yeah, I think that answers that.
Next doubt is, what is the reason of worms developing at the motion area of kids? What can
Hmm.
be? Oh, sorry. What can be its
Hmm.
solution?
That is pinworm. When kids have nocturnal itching at the perianal area, that is enterobius vermicularis pinworm, and this happens because of fecal-oral contamination. Most intestinal worms happen due to fecal-oral contamination. Prevention: hand washing, keep nails short, maintain food hygiene, maintain water hygiene. Otherwise, if child is currently having symptoms, you give albendazole 400 mg daily for 3 days, and the pinworm will be gone. If they have no symptoms, but they are in the age group of 1 to 5 years, especially, they have a high tendency to develop intestinal worms. So you do routine deworming once in every 6 months with albendazole 400 mg for more than 2 years and 200 mg for less than 2 years. And yeah, that's it. So it's also in the government program, na? Every year, February and August. These are deworming months. So even in the villages, etc., they do it in Anganwadi centers and in schools that they supply these albendazole syrups and albendazole tablets, and they do routine deworming.
Next doubt is, ma'am, what made you choose NEET PG over USMLE?
That is very personal, actually. My parents have two daughters. I'm the elder one, and my sister is the younger one. And she had this plan of going to US because she was doing engineering. So she had to go to do an MS and settle over there. She had this idea of for herself. And I felt if both of us go away, then our parents will be empty nesters, and At least if I'm here, I can bug them every week or so, and they can feel कि हाँ भाई हमारे बच्चे हमारे साथ हैं. So it was a personal choice. It was nothing, कि I wanted. I felt that this was better for me career-wise or nothing like that. That was one thing. And the second thing that I felt was when I got into medicine or when I wanted to be a doctor, that decision was taken maybe when I was 5 years old for me on my own. So when I thought of becoming a doctor, the first thing that came to my mind was I want to help people out. That was the reason I got into this medicine journey. So each time I was struggling in internship, my sister was already earning in Wipro. I was struggling in my MD, and my sister already had a job, and I was seeing people getting ahead of me. I was having babies, and I was still not earning enough. My husband was not earning enough to, have a luxurious living for us. The thing that kept me going was I need to be able to do this for a greater good, a cause that will be higher than me, that will be greater than me. So if I did USMLE, yes, I would have a more comfortable life. I would have had I would have had greater earnings at this point of time. But for me personally, it would not fulfill me in that way. That fulfills me now. Like I sit in the setup right now, I see maybe 20, maybe 30 patients each day. If I want to refund for a patient, luckily my husband is also in the same zone that we are both of the same mindset that we need to do benefit to a large group of people. So if I see somebody who is not earning that well, who has a huge family to provide, who I know is a single mother, has a lot of kids, I know that she requires that help. I can give her a discount on my consultation, or refund of the consultation, or a discount on the medicine, on the lab. And this setup, this capability, this freedom, it fulfills me. I might not be earning as much as other people are earning. I might not have that luxury in my life at this point of time, but what fulfills me, I have that. So that is why I made this choice.
The next doubt is, ma'am, how to strengthen overall knowledge rather than exams like NEET PG, USMLE oriented study?
Yeah. For that, you need to uh, first understand where you are going. Hmm. What is it that you want? You always have to have that vision in your mind. For me, that vision was I was in a dilemma whether to choose gynecology or pediatrics, but whatever, I needed to do something in the women and child zone. That was for sure for me. So I felt that when a person comes to me as a patient, I, as a doctor, should be able to take care of every aspect of their issue, whether that be physical, whether that be mental, whether that be financial, whatever be it, the person can come to me and feel relaxed. That was my zone. So I wanted to educate myself in a way that I am able to help them in that way. So for that, I not only need to read textbooks, I also need to develop my communication skills. I also need to develop my social skills. I also need to develop my emotional skills. So you, if you have your exam in 1 year, take care, spend 18 hours a day, study, get that exam done with. But when you're doing your post graduation, when you're doing your internship, when you have that opportunity to speak to a patient, connect to a patient, learn from the patient, don't just look at, you know, hydrocele, hernia, this sign, that sign. नहीं. क्या माँ कितने बच्चे हैं आपको? आपके शौहर क्या करते हैं? आपका घर कैसे चलता? You know, just a small question. If a person has lost their child, put that hand on their back. Stay for those extra 5, 10 minutes. It might break your heart if you, especially if you have your own children, to witness parents losing their children will break your heart. But that time that you spend with the patient, that empathy that you give them, that opens you up also. Opens you up as a person, makes you a better person each day, and makes you a better doctor each day. So choose to spend a little bit extra time than necessary with each patient that you see. An extra smile, an extra, how are you? Really, how are you? That will teach you what you need.
Ma'am, there is a doubt, ma'am. She's asking, can you preparing for PG is good by going offline, or utilizing the online resources, whether offline or online?
Ideally, मेरे हिसाब से uh, go the offline route. Reason one, they have a set schedule already for them. You have to go to the class. You have to sit for those 12 hours. You have to cover that portion. So that puts a pressure on you. Go attend the offline class, write all the notes, and come back. And these 3-4 days that you have in between, you can prepare those, you can read those notes, and you can answer the questions from online sources like Marrow or Prep Ladder. The same topics you can answer in the online sources. And grant tests, you can again take it online on your own. Me personally, I used to feel that I need to put that added pressure on myself to study. So I would always go for offline classes. And when I get that 3-4 days of a gap period to study, I would not study at my home in my own room. I would go to the library or the reading room to study, so that it mentally it prepares me that हाँ चार लोग पढ़ रहे हैं, so I also feel motivated to study. If I am feeling a bit sleepy, if I'm at home, I will take a nap. But if I am seeing other people are studying, I'll be like हाँ ठीक है, I'll stretch it more, 1 hour more, and I'll take a 10-minute nap at the table and I'll continue again. So to get into that mindset, you need to push yourself a bit, and offline gives you an extra edge that way. But if you are a very motivated person and you are able to do it online, you can do it online. It is more convenient for you. You don't have to spend time traveling. And if you are currently doing your internship from a private medical college where you do have to go, but you don't have that much of work, then you can prefer online, because you have to be on the campus, but you have the time to study, so you can go with the offline source. Oh, sorry, online source.
Ma'am, someone is asking how to improve your communication skills, especially for a person who is an introvert.
Communication skills improve करने के लिए, like communication skills are like a muscle. You have to exercise them over and over and over again. I am not going to say that I'm an expert right now, or even I think you have all seen Dr. Fizal. He is also not an expert right now, but the skills that we have developed over time are through exercise, through talking with a lot of people, through talking with a lot of patients, through talking with our juniors, through talking with our seniors, through talking with our professors. You know, every opportunity that you get, try to have a say. I'm not saying ki budge in and, you know, speak out of turn, but wait for your turn. And when you get the turn, when you get the opportunity, don't sit back. Stand up. Be okay with making mistakes. First thing, be okay with making a fool of yourself. That is when you will learn. ज्यादा से ज्यादा क्या होता है, 4 लोग हंसते हैं, 4 लोग मजाक उड़ाते हैं, 4 लोग 4 दिन बातें करते हैं, पर उसके बाद में भूल जाते हैं. But you get that opportunity. No one is a born confident speaker. No one is a born, you know, great at communication skills. हाँ ठीक है. Some people have that personality of being an extrovert. Some people have an introverted personality. I personally was an introvert when I was in school. When I was in my intermediate, I was an introvert. But over time, I took opportunities. I started speaking more and more with people in different languages. I speak with a patient who comes and speaks in Telugu also. I speak with a patient in Urdu also. I communicate with an English person also. So अलग-अलग लोगों से सुनते हुए बात करते हुए you can learn over time. Yeah.
Ma'am,
go ahead, Abdul Khalik.
Yeah, ma'am, what's the opinion like after MBBS only doing job for a certain time? Like, I mean, what's your opinion based on that, ma'am? Like, no PG, only job based on MBBS, ma'am.
That depends on your goal again. Why you are doing it is important. If you are doing it for because you always wanted to just be an MBBS doctor, just be a general practitioner, have your own clinic set up, be done with it, don't want to spend any more time in studying and, you know, building yourself up career wise, it is fine. You can go ahead. You can do it. But you have to be okay with the financial limitations that come with staying over there. Might be. See, sometimes it can happen that a just MBBS doctor who doesn't have any specialization might also have a greater practice than a super specialist. It can happen, but that is an odd thing. That is not a commonality. So if you are seeing one odd person who is just an MBBS doctor earning lakhs per month, I'll also be like him. I can also do that. I'll also stop over here. Maybe that is not the best suited for you. If you are able to, it's fine. But if you are doing it because you are satisfied with this level of knowledge and expertise and you want to serve people from this level itself, it is fine. But if you're doing it for financial constraints, I would suggest you कि again, like I told, try to find out आपके घर को कितने पैसों की जरूरत है महीने में, ओके, बेयर मिनिमम चलाने के लिए, घर का खाना जाना, घर में क्या बोलते हैं, इलेक्ट्रिसिटी बिल्स, रेंट, whatever, daily groceries, basic expenses meet होने के लिए, whatever is the amount that you require, that is the amount that you need to earn. Okay, you can be at zero, it's fine at that point of time, it's okay to be zero.
वैसे का बना के ला लिए नहीं बहुत शीशा चंदाना उनका ऐसा बता था फिर बड़ी खराब होता चलता
somebody is ठीक है. So at that point of time you need to have this goal ki I will earn only this much. For example, it is 40,000, 50,000. Don't try to at this point of time be aggressive and earn more and be like, ha, my family gets all of it, I want to provide the best. For the long term goal, try to minimize that aim at that point of time. Try to find a job that allows you to study, that gives you that freedom of time and that freedom of low profile work, maybe a lot of free time. That kind of a job, if you are able to get and you are able to earn that money to just meet your family's expectations of you, then stop, take that job, study for 1 year and give your best, crack the NEET PG. Once you get into post-graduation and once you get that MD, MS, DNB, whatever your name, your earnings will automatically get compounded, ना? Because जितने पैसे MBBS डॉक्टर को मिलते हैं उससे कहीं ज़्यादा तो स्पेशलिस्ट को मिलेंगे, obviously by rule. So this is my advice. So it depends on what your ultimate goal is for your own self.
Thank you, ma'am.
Ma'am, someone is asking what are the resources which you used during your NEET PG preparation?
My NEET PG preparation was during 2018. 2019, I got into my post-graduation. So it might or might not apply for you now, but I'll tell you the resources. I attended DAMS offline classes, okay? And I made my own notes. I didn't depend on the notes that were already made by them or given to me. I took books with me. I made my own notes. I would always carry, alag-alag colors ke pens so that I can, highlight the points that I need to. And I would sit in the front bench each time. And I would focus completely on the class so that my effort on learning later is decreased, first thing. And the next 3-4 days that I get after each class, I would read these notes and I had Marrow Plan B at that point of time. I don't know what it is called now. Marrow Plan B gave you grant tests and test and discussions. So I would, at that point of time, whatever topics I was reading, I would start answering the questions to that and seeing why my answer has gone right or gone wrong. And I would try to work on that. And once a sizable portion was done, my exam was, I don't remember. I think it was in November. I don't remember. Anyway, 3 months before my exam, I started giving grant tests. Whatever advice I have given you is what I personally follow. 3 months before, every week, I would start giving a grant test. And then 1 month before, every day, I was giving a grant test. And these grant tests were from Marrow. They were from DAMS grant tests that were being given, Bhatia grant tests, whatever grant test was being announced, I would go and give it. And I would come back home and I would see where I have gone wrong, why I have gone wrong. And once my subjects were done, I think they were done pretty early, 4 to 5 months before. My job was to keep revising the notes, to keep giving test and discussions, to keep doing grant tests. And time-wise, I put in at least, I think, 12 hours every day, consistently for 1 year, most of the days, even Sundays. And sometimes I would take an off if it was getting too much or if my health was not cooperating for a while. But I would get back to it. So that is what I did, and Alhamdulillah, I was able to get an All India rank of 1415, 1415 at that time. So that got me a seat in MD Pediatrics in Niloufer. So that worked for me. And different things might work for different people, and different people's situations are different. But I would say my situation was ideal because my parents didn't require any financial support from me. They were fully supportive of me. My mother, Alhamdulillah, she would make me proper tiffins, proper snacks. She was like a backbone for me. She took care of everything on the background so that I could focus completely on my studies. Alhamdulillah, I can say that I was blessed in that aspect. So because of that, I was able to completely, immerse myself in preparing for PG. I didn't have to worry about any other thing. There are a lot of people who might not have that ideal situations, people who might be married, who might have children, who might require some financial, who might need to provide some financial assistance to home. So to each their own, whatever situation you are in, Allah Ta'ala knows best why you are in that situation. Try to do your best, give your best in whatever situation you are in.
All right, ma'am. The next doubt is on what basis should you choose to prepare between NEET PG and INI-CET?
I really don't have any idea about IN. I think IMSA is for PGI, AIMS, वगैरह, है ना?
Yeah, it includes central institutes like AIMS,
हाँ.
Japan, and
So,
NIMHANS.
see, IMSA, if you are very ambitious, if you really want that AIMS tag, that PGI tag, that JIPMER tag, if you are one of those green people who go above and beyond each time, prepare for it, because once you have set a goal for yourself, not achieving that goal will be something that will stay with you for a long time. I was okay with doing MD in a government medical college in a clinical branch, likely something to do with pediatrics or OBGYN. So I was able to achieve that goal with NEET PG preparation. It was fine for me. So I prepared for that exam. It was okay. I don't have any regrets with it. But if you are like, मेरे को एम्स में करना है, मेरे को मेडिसिनिस्ट होना है, तो बैठ जाओ भाई, लगाओ आप 18 घंटे लगाओ, आप आईनीसेट के लिए प्रिपेयर करो, आप नीट पीजी के प्रिपरेशन में नको लगाओ. So to each their own. If you have that strong will and desire to only this will fulfill me, then put in that time, put in that effort, and go ahead with it. But if you are someone who is like, I'm okay with a clinical branch, I'm okay with a government medical college or even a private medical college, I'm not saying decrease your efforts, give the NSET also. क्या हो सकता, मतलब it might happen that you might by chance get in, though the chances for that are very low. You might get in, but your focus is not कि INSET में ही मेरे को वही सीट होना है. Your focus is कि NEET PG में भी सीट चल जाता, no problem. Then prepare for the best, do your best, give your best, but whatever seat you land with, then choose from your options.
All right, ma'am. I think we can end this. We can end the Q&A session over here. There are more doubts to go. As we have, constraint of time, we'll move on to conclude the session. So on behalf of IMSA, I express my sincere gratitude to Dr. Amreen ma'am for delivering an exceptional informative session on navigating your internship with a purpose. Your decision towards mentoring and supporting the next generation of doctors is truly inspiring to all. I would like to express my heartfelt appreciation to the members of IMSA for their efforts in organizing this session. Their commitment to facilitating education opportunities for medical community is commendable. Last but not the least, thanks to all the members who joined us for this insightful session. Together we continue to strengthen our community of medical professions, united in our pursuit of excellence. Thank you for your time and patience. I pray to Allah subhanahu wa ta'ala for success in our future endeavor in our lives. And I request you all to fill the feedback form which is posted in the chat box.
And Dr. Ajay, sorry, I would like to add, you can share my number also in case somebody has some doubts that they couldn't share on the public platform, or some doubts that were not clear. They can personally DM me and I will respond at my convenience, inshallah.
Sure, ma'am. I'll share your number.
Yeah, you can conclude.
Next thing is I have posted ma'am's social media handles. Just join all of them. And one more thing is I have posted TS Medicos 2K20 WhatsApp group link. I suggest you all to join in that group, and we can create a good network among our batch. So Jazakallah khair everybody for joining this session. I'll just post ma'am's number. All right, so we'll end the session. Subhanallah wa bihamdihi, subhanakallahumma, ashhadu an la ilaha illa anta, astaghfiruka wa atubu ilayk. Subhana rabbika rabbil izzati amma yasifun. Wassalamun ala al-mursalin walhamdulillahi rabbil alamin. Jazakallah khair everybody.
Okay.